Everyone, we are Team Sue, and this is our presentation on breaking barriers in the mental health care.
My name is Kate Tucker. I use she, her pronouns, and I'm a third-year Renaissance College student.
My name is Brandon Saulnier. I use he, him, il pronouns, and I'm a fourth-year mechanical engineering student.
My name is Shantel McCraken. I use she, her pronouns, and I'm a third-year Bachelor of Health student.
And my name is Hirbod Abootalebi. I'm a third-year biochemistry student, and I go by he, him pronouns. So first, I would like to go over what our presentation will entail. We will first go over Hans's story and our thoughts about it, and then we go over our multi-step approach to improve the mental health care system in New Brunswick. And finally, we will go over what Hans's story will look like with our solutions in place.
So Hans is an 18-year-old from Sussex, New Brunswick, who has been feeling isolated due to the recent COVID-19 pandemic. Due to limited preventative resources available, Hans's mental health deteriorated to the point where he started experiencing panic attacks. We are going to look at some measures that would have helped Hans during his mental health crisis.
During our research, we found that the current existing resource landscape was very reactive in nature, crisis resolving, or served with afterthought approaches to dismantle issues that have already permeated someone's life to the point where they actually need treatment. We wanted to develop a preventative and proactive approach to the issues at hand. We are also creating a multifaceted approach with various different areas all seeking improvement and implementation. We feel there's no singular gap in the mental health care in New Brunswick, but many small gaps that we can begin to add additional netting to and close in. We feel our various different approaches are able to add new landscape of mental health and serve to break down barriers to accessing resources and help everyone in need.
Fantastic. Okay, so we'll begin with our short-term solutions to prevent any further damage to the healthcare system. So our proposed short-term solution is a resource hub that serves as a consolidated collection of various mental health services available that can sometimes be hard to come by. We propose making this resource collection available in a web page, a mobile app, and a brochure format. Virtual platforms are convenient for people who have access to reliable internet, but we recognize that this is not the case for many New Brunswickers who are already impacted by lower socioeconomic status. We propose making brochures and posters available in areas of regular use, such as grocery stores, banks, recreation facilities, and public transportation hubs. We recommend the same approach for digital spaces and would place promotional material for online resources and apps and sites that many people already spend time on, such as social media and weather apps. Our proposed app and website is simple and user-specific. We're not creating any new services with this program, but are simply creating a one-stop shop for mental health support and wellness advice. We have also developed the ability to experience the app in a wide variety of languages, which are not only limited to French and English, but also Wolastoqey and Mi'kmaq. Given the impact of colonialism on Indigenous people and the lack of culturally appropriate health support, we hope to provide a platform that hosts a safe space for everyone to find the relevant wellness resources and mental health support that is available. Users can choose to look at resources based on their needs, including hotlines to call like Chimo or Kids Help Phone, online chat platforms, general wellness or mental health modules, such as those provided through the Canadian Mental Health Association, different government websites, Indigenous wellness guides, and brand new resources such as the PocketWell app and Bridge the Gap. The solution is available in challenging times, whether that may be in global pandemics or particularly difficult days, which increases its reach and potential use. Additionally, the service would provide specific resources so users can return to the same space for wherever they are in Canada. Our brochure follows the same trend as the website or app and includes hotlines, their respective chat options, more resources available, a wellness tip, general mental health information, and even a QR code you can scan and save the brochure for later. If you scan the QR code, you will actually be brought to the brochure as well and can have a closer look at it. We'll go back to the QR code at the end of the presentation as well. This resource collection is not the first of its kind. In 2018, a team of Canadian researchers created ementalhealth.ca to assist Canadians to learn about mental health, screen for common mental health issues, and find mental health services and support. Surveys were completed by users, and the research found that 93% of users were very satisfied with the website. A 2019 Chicago research team did a study involving pre-downloaded apps on cell phones distributed to people who experience high rates of mental health challenges. Results from the trial showed that daily tips, providing up-to-date resources, and the automated self-help systems were the most well-used features, which are included in our app as well. Like any proposed solution, we are aware that limitations exist. Difficulty accessing internet resources and monitoring program usage will be addressed through paper products and web analytics respectively. Additionally, we recognize that the solution serves as a reactive measure and does not necessarily address systemic changes. Fortunately, we will use the platform to promote wellness tips and tools which aid in upstream intervention and address stigma that initiates a strong start for systemic changes. The cost breakdown is also presented and comes into a predicted total well under $1,000. We anticipate funding being needed for website development, as well as printing services for the paper products. The resources do not bring any additional costs as they are already developed. Since app development can get costly, we propose the use of student or volunteer services to code the simple app. In summary, our short-term solution proposes an accessible and consistent way to promote mental health resources. Additionally, the promotional aspect increases the visibility of mental health within communities, which in turn reduces stigma.
Now we'll be moving into our proposed midterm solutions. Unlike the stress of midterm exams, we are promising solutions that will be able to drastically reduce stress and mental health issues in the long run, but do need added time to fully develop and take effect. These need background work and logistics to be properly set up. That can be implemented with a lot quicker of a timeline than our full long-term solution, with remarkable benefits all the same. Our first midterm solution falls in similar ties to our short-term Band-Aid solution. It is a recommendation for an in-depth look at redesigning many of the current websites and resources available to adapt the user experience and user interfaces of major governmental health and mental health organization websites to be far more accessible, accommodating, and user-friendly. Working with Horizon Health, Abootalebi, the government of New Brunswick, and many of the resource pages present in the brochures and compilations we've developed, we plan to use existing research on accessible and engaging interfaces and redesign the platforms. This will improve the navigability of the websites and ease of access to resources currently available. This will allowing more people to find the resources they are looking for and feeling confident in the information they find so it does not overwhelm them or deter them from accessing the right care. While there are many resources in existence already and so much information out there, we still see certain barriers that making resources present and known might not be enough to break down. As you have seen in the case document, lengthy wait lists, costly treatments, and social stigma keep individuals, notably those that are in their direst need, from accessing much needed mental health care. These are things we all see and know, what we were told while developing our case. To combat this, walk-in clinic solution to provide accessible treatment to anyone in the community, especially at the most crucial of times in a crisis. Walk-in clinics operate on a single session. The walk-in model is a highly successful, accessible, brief intervention designed to help clients utilize existing resources after a single session, and can be seen as a stepping stone to quicker access to more long-term care if needed, or to assist with working out a plan for care that fits a client's needs. They function on a first-come, first-served basis for the most part, meaning zero cost for clients, no wait lists, no appointments unless extenuating circumstances, and low wait times in general. It is accessible for clients at the time that is right for them. Clients entering walk-in clinics in crises have reported the clinic was there for them when they're in their most critical state, resulting in immediate relief and a regained sense of control. In a comprehensive study, clients were asked to record where they would have gone if they had not gone to the walk-in clinic to access help or support for their presenting problem. According to the data, 59.3% said nowheres, indicating they would have not sought out treatment otherwise or gone to seek support in another fashion. This leads to the story to clients who could have gone down very different paths, with much worse outcomes, especially in a time of crisis. Evidently, however, we recognize that motivating individuals to seek mental health services is a very complex process, and so we are suggesting development of walk-in clinics spread across New Brunswick in community centers, local hospitals, and implementing them in schools as part of normal guidance programs for students, acting as a bi-weekly opportunity to access help. These areas are selected for ease of access, pre-existing direct links to current resources or supports, and ties within community areas to help grow discussions around and dismantle stigma surrounding accessing these help. Due to the pandemic, we also feel that access to a physical space is also a barrier needed to be overcome. So a virtual platform accessible through the clinic's website will act as a safe virtual space and going steps further than normal helplines by providing real therapy during single session counseling. A little bit about how they will operate. Typically, walk-in clinics in other areas of Canada have operated once or twice a week for published hours, and in some areas they are open every day. We feel With a growing landscape of interest and discussion surrounding mental health, showcases there are volunteer opportunities from high school students eager to get engaged with their local communities. To further instill the growing landscape of interest and discussion local aspects of a project like this is the emphasis on incorporating local universities like UNM and UNB to offer co-op or internship opportunities for students to engage and assist these clinics in operating. As of 2017 in Ontario, there are over 20 different walk-in clinics available, and currently there are 7 in Prince Edward Island. As of only a few years ago, there's a single walk-in clinic here in New Brunswick operating for only 3 hours every Wednesday in Moncton. 2 Canadian studies have suggested that walk-in clinics for mental health care are cost-effective and reduce impact on the healthcare system overall through earlier intervention and reducing strain on existing professional practices. While cost-effective, we know that our $10,000 will not be able to sustain much apart from initial conversion of a few spaces for walk-in setup. Therefore, we have allocated $8,000 of our budget for immediate reorganization of existing spaces for temporary access. Therefore, additional funding through hospital and community funds from foundations, government grants, and the like will be needed for long-term implementation of the clinics as they integrate into routine operation in New Brunswick healthcare, with promise to reduce strain on medical costs in the long run.
For our long-term solution, we plan on adding mandatory mental well-being class to the school curriculums. Studies have proven that mental health of the youth is an integral part of their overall wellness in their adulthood and have revealed majority of mental health problems can be identified and addressed from before 18 years old. So why should we teach mental wellness in schools? One of the most important reasons is the accessibility. Most children, no matter their socioeconomic status, have access to public education in New Brunswick. This will provide a platform to reach a large portion of the population, as kids will share the information they learn with their parents and peers as well. Studies have also shown that mental health has a close correlation with academic performance and dropout rates. This can be an opportunity for early detection. And third, children spend around 8 hours a day in presence of teachers and school staff, often longer than they do at home or in leisure activities. What will teaching mental well-being do? One of the main objectives is to raise awareness. This involves teaching what mental health means and how to maintain positive mental health, and that they are responsible for their own mental health. In addition, it would teach that not only children, but parents as well, how to recognize mental health related issues in themselves and others. Furthermore, it will teach children healthy coping strategies to common mental health challenges, and by talking about mental health, we can promote greater acceptance and understanding, which will in turn increase seeking behavior and reduce the stigma. This will also improve academic and work performance, which will be financially beneficial. And lastly, one of the most important outcomes is that it will save lives. As we mentioned earlier, suicide is the second leading cause of death for youth in Canada. Bringing awareness to the symptoms of depression and other mental illnesses can help teens identify these issues and seek help before it is too late. So now we'll go over some of the teaching objectives and how we plan on teaching the course. One of the key objectives is creating a safe space where students feel protected to talk about their problems and ask questions they may not feel comfortable asking parents or peers. Educating students with relevant materials so they will be able to identify signs and symptoms, and providing them with proven tactics and coping methods to battle common mental health problems. And lastly, to promote and educate students on a holistic approach to wellness. In schools, we found that physical education is mandatory, but many of the topics such as emotional, social, and spiritual wellness are often neglected. Within this class, we'll put an emphasis on all pillars of wellness. So has this been implemented anywhere before? And the answer is yes. In 2018, New York and Virginia added mental health instructions from kindergarten all the way to grade 12. The changing curriculum includes identifying appropriate professionals, services, the relationship between mental health and substance abuse, and other coping behaviors. British Columbia and Florida have also added mandatory mental health education within their school curriculums and have found that long-term changes to the school system are far more effective than short-term courses. Now we will talk about some of the limitations on how we will overcome them. The pandemic has definitely affected the mental well-being of the youth and the teaching staff. Although we have lost the advantage of teachers being in close contact with the students on a daily basis, it is even more important to emphasize teaching healthy coping mechanisms for the lockdown. And when teaching mental health, more information is not necessarily better. In fact, it might worsen the outcomes because of information overload. In pursuing mental health literacy, educators need to be mindful of the central goal, which is not whether students gather more knowledge about psychiatric diagnoses and evidence-based care, but whether this knowledge will lead to change in behavior. And finally, for the budget breakdown, I would like to elaborate on what I mean by free. Of course, nothing in life is free. However, all of the proposals that we have mentioned are already in place and just need an adjustment of our resources. For example, the majority, if not all the universities where teachers gain their education degrees from, offer psychology, development, and mental wellness courses. It is just a matter of them being deemed as essential. For teachers that have not received the training already, there are mandatory professional development days that already exist, and this can be an appropriate time for them to catch up on the training for mental health literacy. And finally, for any project, there needs to be a way to evaluate the progress. Students in New Brunswick take mandatory surveys about their mental health every year. With the implementation of these courses, we can monitor what works and what doesn't to adapt this plan on the coming years.
Finally, I'm going to introduce some further long-term proposals that require government intervention. These include mobilizing mental health clinics, utilizing internationally trained healthcare providers, and implementing physical protective barriers. We believe the first two proposals will serve a benefit to rural communities. As someone who lives in a rural area, I can confirm that transportation and a lack of healthcare providers are serious limitations for local communities. The COVID-19 pandemic has brought many of these issues to light, but since these problems are due to lower socioeconomic status and marginalization, solving these problems requires proposals that will require government intervention. To intervene, we suggest mobilizing mental health care. Mobile clinics will be a great opportunity to bring resources to remote communities. The New Brunswick government has acknowledged how important this is, especially in light of the pandemic, and has recently announced that they would pledge $900,000 to fund mobile mental health clinics. But what they haven't announced is who is going to work at these clinics. We suggest using internationally trained healthcare providers to fill these roles. Canada has very strict rules that prevent many internationally trained healthcare providers from practicing in Canada. But looking to the UK as an example, they understand that since disease knows no borders, neither should the ability to practice medicine. They have updated their code of practice to a non-discriminatory model, which allows internationally trained healthcare providers to apply for sponsorship, thus accelerating their pathway to practicing medicine in the UK. We would also like to acknowledge that we can't save everybody. Fortunately for Hans, he was able to find a coworker who had the proper resources, but so often this doesn't happen and many people suffer in silence. For these reasons, we firmly recommend the implementation of barriers, physical barriers, for those who do try to attempt suicide. A 2017 study from Switzerland found that physical barriers placed on common sites of suicide reduced overall suicide attempts by 82%. That being said, we understand that one barrier to our proposal is funding. What is free, however, is sending an email to the office of your local politician asking for these measures to be put in place.
So how could our solutions change the mental health outcomes of New Brunswickers? In terms of Hans, we can see that our solution would have provided full coverage for mental health support. Beginning in grade school, Hans would have learned about mental well-being. He would have been able to identify signs of struggle in himself and have had healthy habits in place. If Hans had slipped through this crack, he would have been able to attend a walk-in clinic and access mental health services quickly when he was in need. Even without the walk-in clinic, Hans would have been able to access a healthcare provider due to our suggestion to implement an international recruitment strategy and mobile clinics. If all of these systems had failed, Hans would have at the very least been able to identify services that can help him through the brochure in his community and websites or apps available to him. Overall, our series of proposed solutions creates a safety net that supports New Brunswickers in maintaining good mental health and allows for upstream intervention and systemic changes. These are our references. And this is a quick summary of our presentation. Thank you so much for attending today. We are so happy to take your questions at this time. I think we're ready for the first question.
Yeah.
Wonderful job. And I absolutely love this summary that you've provided. This is a gorgeous graphic here of your program. So one thing that I wanted to ask you about is, because you had mentioned the idea of sort of dismantling stigma and how your program would address stigma. Can you speak a little bit more directly to how you think that your solution would affect mental health stigma?
I would love to jump on this if that's okay with you guys. Yeah. Yeah, for sure. That's a great question. And for example, especially looking at, for example, the school or implementing mental wellness in school, being exposed to mental health or mental wellness and what it means to have healthy mental health from like a young age, that this is kind of a long-term solution, but we could like implement it right away. And when parents, like kids go home and talk to their parents, for example, and then the teachers are also learning about mental health literacy, they will, knowing that these problems are okay and everybody's aware of them, it will slowly turn to like in a few years, it'll just be a common knowledge, and like how mental health is not, it is very like separated right now from the wellness, but once we incorporate it with all of like just like physical wellness, for example, it will less stigma will be less stigma will be there to getting help.
So it sounds like part of what you're speaking to then is culture change, and that ultimately this will help to motivate culture change. I think one of the other things that might happen through your program is, if you're introducing this in schools and people are having open conversations, it could potentially also inspire like what we call contact in the stigma field. Like, you're going to be interacting potentially with people who are perhaps speaking to their own mental health struggles, and that can also kind of demystify it. And so you're spending time with people who are experiencing these issues, and that is one way of certainly reducing stigma as well. So yeah, thank you so much for your presentation.
Yeah, you can go ahead, Victoria.
Hi, good morning. It was a great presentation, and I agree. I think that starting young, like getting it implementing into the schools, would be amazing, because if the children can openly talk about problems and see that somebody else right beside them or behind them, they have an issue too. Like, I think that is huge. Like starting them young, they'll go home and talk to their parents. I really like the idea of the walk-in clinics and the mobile health. I thought this presentation was excellent. And I agree with that, to start right from the beginning, where kids don't see that stigma, that it's okay to talk about your problems. Get it out there. I loved it.
Thank you very much.
Thank you.
Thank you.
I see we have another hand up.
Yeah, I just wanted to more or less make another comment. I thought this presentation was really well laid out. I thought that your short-term, mid-term, long-term solution seemed really feasible too. Like the other judges had said, the long-term solution, starting, really, really, really upstream with these kids in school is fantastic. There will be no stigma if we're creating this culture right from the beginning. I also loved that you incorporated an evaluation plan for your project, because what's the point of doing any of it if we can't prove its worth? Because that's kind of right now what I'm doing my doctoral dissertation on. So awesome. I'll do your evaluation plan when I'm finished. Yeah, congratulations.
Thank you very much.